At around about the 6-month mark, when we do our 6-month check, we do a thing called lift the lip, which is basically lifting a child's lip, and we will do a referral to the dentist if we have any concerns, but that's normally not until later on. We just check for teething and tell parents signs of teething and all that kind of stuff. We assess the gums and teeth for signs of decay or early signs, and we promote oral hygiene and to clean babies' teeth or just clean gums. So we tell them to clean the gums at 6 months of age with a wet face washer. That just gets the child used to something in their mouth as well. Makes it easier to do when they get teeth. Avoid using bottles to sleep because even milk can cause decay on children's teeth. Low sugar diets, healthy diet basically. Have the child watch parents brush their teeth, so they want to do it too, it just encourages them to do it. Soft toothbrush, that's all you need. You don't need any medium or hard. Even adults just need soft toothbrushes. First dentist visit, 18 months to 2 years the dentist likes to visit here. I don't know if all states are the same. And we always promote that the adult helps the child clean their teeth until they're 6 years of age because they don't have the dexterity to do the backs. So by all means, get the child to clean their teeth and then just have a quick go. We did have a question about Aboriginal and Torres Strait Island families. In Tasmania, there's not a huge population of Aboriginal and Torres Strait Islanders. However, we do have the TAC, which is a group that the child health nurse is available for at the Tasmanian Aboriginal Centre, it's called. They've also got a GP, educators and different programs. So if at the initial home visit somebody identifies as an Aboriginal Torres Strait Islander, we will ask if they want a referral. Quite a lot of the time they'll say no because there's only one centre, whereas with the child health centres they're community based and so it's easy to access our service. But sometimes they do, so we just send a referral through. There's also CTAC, which is the South East Tasmanian Aboriginal Corporation that also do some child health checks as well. And they support elderly and disabled families as well in that service. So we don't get a great deal of them.
So can I just ask, do they do exactly the same checks as you do? Or is there a crossover? And what sort of checks is that service?
So in the past, I believe, because I don't do too much of it, the CHAP service, so the service that I'm involved with, actually had a nurse that was a part of the TAC, and so they would, and then they had one that was employed by the TAC, so they would work together. Funding's been cut for that position this year. Don't know what's happening with it. So technically they should be doing the same, they've all got the same blue book, so they should be doing the same kind of stuff. Yeah, that's okay. But it's not my area of expertise, unfortunately. Your turn.
So you'll be pleased to know you don't have any homework now because we have time to do our milestones activity. So looking around, I can see there's lots of bits of paper on your desk. Not sure if you can see this, but try and find one that looks a bit like this.
That one.
That one, actually.
That one.
Yep, so either individually or person next to you, however you like to do it, just have a little look at the different milestones that are listed. And you know, there's no right or wrong answer because kind of using this as a learning activity. Just kind of putting across, or however you like to mark, what age that milestone is, when you'd like to see that milestone, when children should be doing that milestone. But it can be a little bit varied, but just pick the age that kind of you feel you would see that at, or be worried if you didn't, but yeah. Everyone's got a copy to fill out, have they?
In your Tasmanian blue book, equivalent. Do you, so we get a summary of this at the beginning of each check of what to expect, so you can read it or go through it if you want.
Yep. Yep, so we have anticipatory guidance style milestones as well. So at the 8-week check, I think we see a page on milestones for 3 to 6 months. So yeah, and then so at the 6 months it will be the 6 to 12 month milestones. So kind of what you're expecting to see between child health appointments. Yep. Yeah, I think I've got one. Thank you. How are we going? Does anyone need a bit more time or kind of pretty good? Yep, bit of gossiping, so it must be time. Very good. So we'll just go through them as a group. So people, you can just yell out an answer. As I said, it doesn't matter if it's right or wrong. It's a learning experience. So yeah, so it turns towards sound bilaterally. What did people kind of think with that one? 4 weeks? Yep. So the posterior fontanelle is closed. Do people know what the posterior fontanelle is? Yep. So it's the little one at the back. Yep. This is the anterior fontanelle, or the soft spot as most people refer to it. When is that one closing up by?
6 weeks.
Yep. Yep. A few varied answers. We look at about 8 weeks. So social smiling. It's a beautiful one. Yep. Yep.
Sorry, what was that?
So we look for it at 8 weeks. Normally see it starting around 6 weeks, but we would be alarmed if babies weren't giving social smiles at 8 weeks. It might suggest that something is wrong with their vision. So yeah, we always look for it at 8 weeks. Following an object past the midline. So that's holding a toy over here and then bringing it around, and baby actually follows it. Yep. Yep.
What was that? Sorry, we can't see any response.
Yep. So 4 months. Yep. I'm not very good with microphones. Sitting with minimal assistance. So they might need a little bit of support, but not much. Yeah, everyone knows that one. Good. Babies putting their feet into their mouths. Yep, so we actually look for it at 6 months, but you may start seeing it at 4 months. Yep. So when you're holding baby up, when are we looking to see if they can put weight through their legs, or a lot of weight through their legs? Yep, so they will start at 4 months. At 6 months, they definitely need to be doing that. Yep. They will grasp an object voluntarily. So someone might be dangling a toy and they might try to reach out to swipe it or kind of grab it. 4 months? Yep, 4 months. Imitate sounds such as or,
8 weeks.
Yep, so 6 months is when we start looking for imitation of sounds. Babies will coo and make noises earlier than that, but it's more those defined sounds that we're looking for. Holds a gaze on an object. So kind of staring intently, purposefully at an object. It might be a face or a toy or an older child. Yep, so 4 weeks is when we will start looking for that. If babies aren't doing that at 8 weeks, that's a big flag for us. Yep. Lifts head when prone. So when they're on their tummies, they lift their head up and they look around. Yep. 4 weeks. Exploring toys with the mouth. Yep, 4 months. They roll from their back to their front. So there's another one a bit further down. So, but rolling back to front we see at 6 months. Yep. Tracking with their eyes 180 degrees. So instead of using their whole head, they're just looking with their eyes. You might find that they're, following a parent around the room or, really looking at what's going on. Yeah, so we actually look for that one at 8 weeks to make sure that they are actually tracking parents around the room. Yep. Cooing and vocalising, very cute. When do babies start cooing?
8 weeks?
So 4 weeks. Yeah, yeah. Actually, babies poking their tongues out at you and starting to coo, it's the very first stages of language development. So it actually begins really, really early. Yeah. Beginning the use of a sippy cup. Yep, good one. 6 months. 6 months. Yep. Recognises familiar faces. So probably more so mum, dad, a grandparent or key caregiver. Yep, so at around 4 months. Yep. And rolling tummy to back. Yes, that one's 4 months. That's the one we tend to see first. Yep. Baby is responding to their own name. Yes, they generally lose the ability at about 2 years, don't they? They think they're very clever when they start. Then they realise they shouldn't have done that. Yeah, but in reality, when do they start doing that? Yeah, around 6 months. Yeah. And kicking vigorously with their legs. Yeah, at about 8 weeks we start looking, that they're using their arms and legs evenly and vigorously as well. Yep. It's busy. Yep. So for those that missed any, that's what it looks like. So just to continue on a little bit with the developmental milestones, just to recap. So at around 2 months we see babies smiling, following objects past the midline, lifting when their head is prone. 4 months, when pulled to sit, there's much less head lag. When you pull babies like newborns to sit, their head might come right back. But at around that 4 months of age, you start noticing that they come up more in a flat plane. So there's some other ones there as well, but watching movement of their own hand as well, reaching to grasp toys and turning towards sounds. 6 months there's a lot more, and I guess that's a really important time for you guys if you're doing immunisations and things. I mean, they're at 4 months too, but 6 months there's probably a few more milestones to look for that are very important. So most of this is looking at muscle development as well, and gross motor skills. So sitting with some support. So if babies are having no desire to sit or roll, move at 6 months, that would be a bit of a red flag for us, and we would refer them to a physiotherapist. Even if they're not weight bearing through their legs, we would discuss with parents how to improve baby's leg strength and start doing some exercises. Otherwise, referring to a physio. Passing a toy from one hand to another. Before that, they just pick it up and drop it. So actually doing that passing. But once they might have an object, and if you hand them another one, the other one just kind of goes to the side and, hey, I've got this one now. They'll laugh and chuckle, and they'll show recognition of their carer's facial expression, happy and sad. Yeah, so they can start to pick up on those emotions at a very young age. These are some of the growth milestones we look for. This is all based on research and policies through the NHMRC and also the Royal Children's. So, from birth to 4 months, looking for weight gains of around 150 to 200 grams a week. We don't like to get too fixated on these numbers, especially with some breastfed babies, because that can increase maternal anxiety, but at the same time, you need to find the right balance with, getting adequate nutrition into the baby. But we know that there is a bit of a range. 4 to 6 months, the weight gain reduces, mainly because they become more active. We've got the 100 grams to 150 grams per week. Once again, it's not exact, but just a bit of a ballpark figure. Handing over to Jess.
I'll get the unsettled one.
So quite often we see babies like this that come into the clinic. And we've had lots and lots of questions about unsettled babies. That's probably the most kind of questions that we get, and why is my baby unsettled? So there's so many different things that can cause an unsettled baby, and a lot of the time it's ruling things out to try and get to something at the end. So colics really just excessive and frequent crying in an otherwise healthy baby. So basically, if you can't find anything else wrong, they put it down to colic. So just remembering that in the first 3 months is a time for gut maturity and developmental changes in the baby. So that can cause some tummy upsets as well, so which can cause some colic. If a cause cannot be determined, it's recommended that the baby is assessed by a medical professional just to rule out any medical causes. With reflux, so sometimes reflux is really obvious, where a baby is vomiting quite often, large amounts, and is really upset and painful cry. So reflux generally is when a child brings up the stomach contents back into the food pipe and the mouth. It might be evident through the vomiting causing pain, frequent and excessive swallowing, unsettled, especially when flat, wakes with a scream from sleep, like a really painful cry. But it can also be a silent reflux, which is showing those symptoms but without the actual vomiting. So sometimes they actually get quite an acidic smell with their breath. Quite often they do that lip smacking kind of swallowing kind of, which is just them re-swallowing what they've brought up, but they don't actually vomit it out. That's a good indicator that it could be reflux. There's a few things that you can suggest to try and help the baby with this. So keeping them upright for at least 20 minutes post a feed. A lot of mums like to do the baby wearing, that can really help, especially if they're busy and got stuff to do and other children and all that kind of stuff. So wearing the baby is quite helpful in some cases. We can also do smaller but more frequent feeds. So rather than feeding the baby a larger amount every 4 hours, reduce that size of that feed to maybe every 3 hours, 2.5 to 3 hours. So that way the stomach's not quite as full, so they can have more chance to bring it down, keep it down, I mean. And you can also just refer on to your GP for maybe medication if it's severe enough. Overfeeding can be a cause of unsettled babies. That's when the baby receives too much food. Usually within a formula fed baby, not as common with a breastfed baby. And that can just cause the stomach pain and the vomiting. So what we do is we work out what the baby's kind of doing with the mum, how often they're feeding, how much they're getting and all that kind of stuff, and we work out kind of quotas and things like that, and give them to space out the feeds a little bit more and that kind of thing. Underfeeding, another very common thing. So with an unsettled baby, we would maybe try regular waking for feeds, especially in the early days, especially if they're jaundiced, because sometimes jaundiced babies don't wake themselves enough to feed. We'd monitor their weight gain and we'd monitor their output with the parents as well, and give them goals to work towards. So 6 to 8 moderate to heavy size wet nappies a day, which is what a breastfed baby, because you don't know the input, that's what you would look for, is the output. You would check that the baby's not mottled and skin's looking dry, mucous membranes aren't looking dry, waking itself for feeds, bright and alert, that kind of thing. Also fontanelles, if they become quite dehydrated, can become sunken in, and that's a good sign of dehydration. If they are formula feeding, it's easier to work out a quota with actual volumes, but otherwise it's the nappies. Yeah. Constipation is another, I don't know how many times you get parents coming in talking about babies constipated. Sometimes it's about normalising bowel habits for mums, especially breastfed babies, because they're used to having a bowel action every 2 minutes with a breastfed baby to start off with in the early days, and it can go up to 10 days without a bowel action, and that can be completely normal if the baby's comfortable and settled, and they normally just do a very large one. So it's more the consistency of the bowel action than the frequency. So if it's starting to get a little bit firm, like the rabbit pellets, or even just a little bit more solid, then it can be a sign of constipation. Extremely rare in a breastfed baby, more common in formula fed babies. So what we would recommend with that one, we can say a little bit of cooled boiled water, so 20 mils once a day, or 10 mils a couple of times a day, just a small amount. That can help with constipation. We do the whole little bicycle legs, the legs up to the tummy, giving the baby a massage on the tummy as well after a bath, and if you go in a clockwise direction, that's the way that the gut works. So that can help with trapped air, and even a bath, just because that relaxes everything as well. If it's still occurring, then to contact your GP as well for medical advice. And if there's obviously any blood in the stools, then GP straight away as well. Parental wellbeing, a lot of the time we have mums come in, or dads or whoever, saying that the baby just won't sleep and it's a sleep issue and they're focused on sleep. A lot of the time it can be parental anxiety that can cause that, and that's a little bit of a tricky one to talk to parents about. But it's trying to make them aware that if they're anxious, then the baby's going to be worried as well and then become unsettled. So our kind of recommendations for that are, if you've been trying to settle your baby for a long time, you're getting upset with it, the baby won't sleep, pop the baby down for a few minutes, step out of the room, pop it in a safe cot, in a safe spot, step out of the room, have a breath, have a cup of tea, settle yourself down, because no one's going to get settled if you're screaming and you're getting really uptight about it. Then baby's safe, and give someone a call as well if you need to. And lastly is like medical conditions. Whilst we know a crying baby is normal, it is important not to underestimate the concerns of their caregiver for their baby. So some medical conditions can be like bowel obstructions, UTIs, meningitis, drug withdrawals or non-accidental injuries or anything. It can be lots and lots of different things. So it's important to listen to parental concerns, and they're around their baby 24/7. So yeah. So we're going to do the sleep, and the other obviously is the sleep and settling stuff, which we'll start again.
Very good. So previously this slide came up without the picture, but we've fixed that one. So yes, as I was saying a bit earlier, the sleep cycle in a baby lasts around 40 to 55 minutes. Sleep does promote sleep. We often hear parents say, my baby sleeps all night, so I don't care if it doesn't sleep in the day. You know, and then I guess you just start thinking about, well, is that baby getting enough rest for growth and development? But we hear all sorts of things. You know, it's really not our job to butt in and say, hey, you need to be doing this. But if parents are really having a struggle with it, then we will definitely provide support, or we'll say, you know, is that okay for you? Is that going okay for you? Or would you like some support and advice to help keep your baby asleep for longer during the day? Because a small baby that is awake all day is quite exhausting for both parties. So we do offer support, but we're not sleep gremlins either. Some babies need transition to move between sleep cycles. So from here to here, well, this sort of arrow being 0 and this side being 55 minutes, this is a sleep cycle. So baby will be awake at 0 minutes. Then they go into a drowsy phase and into a deep sleep. Then they transition into REM sleep, rapid eye movement sleep, dream sleep, light sleep. And then from there, they'll either wake up or they'll transition back into sleep. So babies that catnap, probably hear that term, my baby catnaps, stays asleep for 10 minutes, I put the baby down and it's awake again. So that's this stage here. So they're getting drowsy, that's nice, they might be in their arms or they might be in the bed, in the cot. But then at this 10 to 20 minute stage, they're actually not able to transition into the deep sleep. I think it probably happens to adults as well. You feel like you're in bed and you're like, yeah, kind of drowsy, and then you just find you're in this dead space for hours, it seems, where you just can't go off to sleep. Yeah, so then babies will wake at that about 35 to 50 minutes. So if they transition into deep sleep, but they wake up at about 35 to 50 minutes, sorry, I didn't explain that very well. So then if they can transition, then they'll go into their deep sleep, and then again into their light sleep, the REM sleep. But then if they're waking up between 30 and 50 minutes, it means that they're having trouble transitioning into the next sleep cycle, the next stage. So you might say, hear mum saying, my baby sleeps, but they only sleep for 45 minutes at a time. So that's one sleep cycle. Ideally, it would be nice for babies to have 2 sleep cycles, especially in day sleep. So I guess just to help understand the transitions between sleep cycles and when babies are waking up, why they're waking up. Sometimes that helps parents understand, oh okay, so they're actually having trouble transitioning, because some parents get into a state of, my baby's waking me up because they knew I was going to go and have a shower. They knew I was going to the toilet. But they don't work like that. Yeah. So their brains aren't complex enough to think in those sorts of terms, but for a lot of parents that's exactly what it feels like. Yeah. So it is important to reiterate that message as well. Your baby is not crying or waking up to annoy you, to stop you from doing things you've been waiting to do all day. Yeah, does that make sense? Does anyone have?
What age?
So I guess we're focusing up to 6 months, and it's certainly between birth and 6 months. Sleep cycles do progressively get a bit longer as children get older, but certainly for birth to 6 months, this is relevant. Yep. You'll find, newborns, you talk about how long should my baby be awake for. I mean, we don't stick to hours, but I guess as a rough guide, looking at about, a newborn being awake for an hour, maybe an hour and a half, and they're 6 months old, it might be more towards 2 hours as a rough guide. We always talk to parents about looking at your baby, trying to observe what your baby is telling you. So if your baby's been asleep been awake after a 2 sleep cycle of sleep, and they've been awake for 30 minutes, and they're showing you that they're tired. So it's not cut and dry. Yep. It's just all about learning what your baby is trying to tell you. Yeah. And we'll talk about tired signs a little bit more in depth as well. Any other questions? Fact or myth? An overactive baby is a baby not ready for sleep. They're ready for play. Yes. It's a common misconception that parents put their babies down, but then they're just really active. So they obviously want to play. They don't actually want to go to sleep. But yeah, it's a sign of overtiredness. Sometimes we get overtired, you kind of miss the boat altogether, and then it's waiting for the next stage to come. But they'll often be quite cranky in that time, and that's when parents are trying to put their baby to sleep, but they probably won't play the game. So that one is a myth. So observing the overactive baby is a late sign that the baby is overtired. So what are some tired signs? We did go through them briefly, so you've had a bit of a heads up, but what are some tired signs that you might observe in babies, or you might ask parents to look for with babies when you're talking about an unsettled baby?
Rubbing eyes.
Yeah. Rubbing eyes.
Not looking at faces, not wanting to engage.
Yep. Arching backs, not looking at faces, not wanting to engage. Yep. Any other ones? Crying. Yep. Yep, clenching fists, fists closed. When babies are awake and happy, their fists are open. That's a really good one actually. It's a nice early one, and it's really obvious. So when babies are tired, they'll lay there maybe like this. Yeah.
They get fidgety, edgy.
Yep, fidgety, bit edgy. Yep. That's a pretty good list that you've all put together there. Scribbled them all down before. Yeah, so if you missed any before, you can write them down a bit calmly now. So yes, closing fist, back arching. Frowning is a good one too. Just showing a general disinterest. So they might be looking into your eyes, and you might be trying to engage with the baby, but then they kind of look away.
Is that like medically proven hiccups in the time?
It can be a sign, yes. Yep. So we don't promote the product that we use, but we use the Safe Sleep Space approach, which was developed in Australia, I believe. You can look at it a bit more online, but it's it gives parents gentle settling strategies to help comfort their baby for sleep.
What is it, sorry?
Safe sleep space. We don't promote it in terms of go out and buy it or anything like that, but I guess they're the strategies that we do use. So it actually lists these tired signs as common tired signs as well. And because I remember when I was working in the children's ward, and everyone used to say hiccups, that's wind. Yeah. But it can actually be a strong tired sign as well. And parents, when you break it down, I'll say, what is your baby? How is your baby telling you that your baby, he's tired or she's tired? And they say they're crying or yawning. I say, does your baby ever get hiccups? And they're like, all the time, always has the hiccups. So it can be one of those things that you can relate. Yep. Pardon? Yeah. Very good. Grasping at bodies and clothes, rubbing eyes, and yawning and crying. They are tired cues, but they are late tired cues as well. So trying to get to those trying to deal with sleep at the beginning. This cycle is feed, play, sleep. So this is what we promote. We don't really talk about, your baby needs to go to sleep for an hour and 3 minutes, and it has to be up for 97 minutes or something. But we do talk feed, play, sleep, and that's about looking at your baby, going back to basics again. So you can see the circle here with the arrows. So they have a sleep, they'll wake up, might be happy in their cot for a bit, then they actually wake up, want to have a bit of a play, might yell out for someone to come and get them, then they can have their feed. Then some nice play time, so it might be having a book or some tummy time, showing them around the house. Observe those early cues for tired, and then go into your settling strategies, whatever parents like to use. Otherwise, a gentle rock till baby's calm, popping them in their cot and maybe doing some patting or rocking in the cot or bassinet. But just letting parents know, just respond to your baby however you think your baby needs, your baby needs. Yeah. So.
Yeah, I've just noticed a lot of babies go to sleep straight after they've had a feed.
Yeah, that's the feed, play, feed, sleep. Yeah. Which there's nothing wrong with that. I guess that's where we see a lot of parents more 6 to 12 months going, especially breastfed babies. I'm the only one that can get my baby to sleep. I just want to go out for a night, but I'm the only one that can get my baby to sleep. Or sometimes dads start to feel inadequate, or another caregiver. Yeah. So it's not right or wrong. I suppose it's just trying to encourage babies to go to sleep when they're tired, but not necessarily needing food, a bottle or a breast. Yeah. So over time it helps to develop independent sleep associations, promote self-settling, and once again just looking for those early tired cues. Very good. And then we're just up to our last slide. Resources. Starting Blocks is a government website. And that one's actually good for health professionals, educators, parents, and it goes through milestones. It's a good milestones one, and also how to help achieve baby milestones. So it gives them like play activities and that sort of thing. Yeah, Raising Children's network is around goes from birth to 18 years. Everything you need to know, pictures, wordy documents, updated by professionals in that area. Australian Breastfeeding Association's good. Child Youth Health, similar to Raising Children's, and Beyond Blue. And Dad's Wise app as well is one we started talking about as well, where it's an app for dads through Beyond Blue.